Hey, this is Russ. We are now up to patient 12F. Yeah, time for another knee patient. So 12F, of course, means that it's female, right? So she is a 63-year-old female from Michigan, right? And she sent me this email message because I had commented that we were losing comments on our YouTube channel. So to make sure that I got it, she decided to email me, okay? And because she emailed me, later on in the email, you'll hear me read that she says, you might as well turn me into one of our patients since she wrote so much stuff. So here's what she says. I'm going to read again off her email here. So she says, I notice whenever you talk about getting a second knee replacement, you seem to think that the experience will be the same as your first knee replacement. Yeah, I do kind of think that. I had my left knee replaced in September 2020 and my right knee in January 2021. Okay, as a side note too, she did send me a second email that said that it was done with the Mako Robotics. Okay, now I don't have much experience with the robotics, so I don't know anything about it, how it works or anything, but she did mention that it was robotics and that her incision was glued, super glued. Okay, so let's keep going. She says, my second knee replacement was a much better experience. Okay, I had very little swelling and bruising with my right knee. My left knee and thigh and ankle and foot were huge after surgery. I had lots of bruising and more pain with my left knee. I was on a walker with my left knee for over 3 weeks and then moved to a cane that had 4 feet, recommended by PT due to instability and balance problems. So she had one of those canes that has that like that claw, 4-foot claw thing on the bottom of the cane. All right. With my right knee, I used a walker for 2 weeks and moved on to a cane, which I used for a week. Now I use the cane only when leaving the house. Yeah, that's what I do too. But I do have the cane at home. I sometimes use it as well. Okay. Where are we here? She says, I followed the PT's recommendation regarding walker and cane use for both surgeries. My flexion was 122 after only 4 weeks, really good, and my extension is 0, all right? My left knee flexion only got 117 after 10 weeks, and my left knee was overextended, which was part of the instability I was having. Okay, now she's gone past 0 degrees. I don't know how that would feel. I'm still stuck at 5, right? All right, so she says that's why she has some instability. Even my scars were totally different. My left knee scar is very large and wide and has a keloid-like thing, and my right knee scar is a thin line. Okay, so yeah, that would be quite different then. Okay. I have been able to flatten out the scar on my left knee somewhat with massage and silicone sheets. Okay, so she is working on it. All this to say, your second surgery may go better than expected. Yeah, basically it could, I guess. You know, the reason I always thought that my right knee, which is not operated on yet, okay, I say yet because we know eventually it probably will. The reason I keep thinking that it's going to go worse, or at least just as bad, is because, you know, I had torn meniscuses on both knees, and then the recovery of that took longer on my right knee. So that's why I keep thinking that when I get my right knee done, maybe I might have some additional problems with the scar tissue stuff again. So anyways, that's why I keep thinking it might take longer. So, okay, so she says, and since I wrote this much, you might as well use my story as you wish. Okay, that's why we're doing it. I'm a 63-year-old female. I retired when I turned 62 due to pain in my knees. My knees were both bone on bone, and I felt like I was losing my independence. I had a hard time taking care of myself due to extreme pain. I was not going to have the second knee done so soon, but my right knee seemed to hamper my recovery efforts. So I decided to get my right knee done sooner. Okay, that's sooner rather than later, I should say. That's what she says. I am pleasantly surprised at the speed of my recovery this time. Okay. And as far as she says about the Mako robotic assisted surgery, she says she can't say whether it was better or worse using the robotics because it was done by the same surgeon. Both knees were done with the robotics. She says, I included a picture of both knees taken today, almost 5 weeks post-op of my right knee. The other is my left knee 1 week post-op. Somehow I deleted pictures of my right knee post-op at 1 week post-op. Okay, so she doesn't have photos for for both to compare, but we can see what they look like, okay? And she says, one more thing I forgot to mention is that my incision was closed with glue, that's super glue, and that is the flaky stuff that you see on the left, on the far end of my scar, okay? Yeah, that stuff eventually will kind of do stuff like that. So that is her story. So she seems to, in my opinion, even though she's had some problems, she's doing pretty good. I think overall she's going to make it, right? So at least, you know, we hear that some people do 2 knees relatively quickly, and she had robotics done. I don't know if that helped or not to make it quicker, but I think she's doing okay. So thank you so much to her for sending the information to us and for sending the photos. Now, when she sent it to me, she didn't send the photos, so I asked her for photos. So anyways, if you decide you want to be part of this patient update stuff, you can do the same thing, and all you need to do is, you know, send me an email to contactrussisright@gmail.com, and then let me know, male or female, how old you are and where you're from. Okay, so I just need to know, you know, what state you're in, and if you have a couple of photos, send that along too, because it just makes for a more interesting video when we have some visuals to see. Okay, here's a side note. I always have a side note. The last time I put these knee video photos up here, my daughter says, don't leave them up so long, it's too much. Okay, if you're not a knee patient, it probably would be too much. So this is why I didn't leave it up as long this time, okay? So yeah, I learned, don't leave it up there for the entire video, because for non-knee patients, it's a little too much for them to see. Anyways, if you like the video, go ahead and hit that like button, hit the subscribe button, and I will talk to you guys next time.